LDS Hospital in Utah Valley Regional received the shipments this morning. Here on Capitol Hill, the governor says it's the beginning of the road back to a normal life.
We are excited at Intermountain Healthcare to be able to offer this to our caregivers as a safe prevention from COVID-19.
Intermountain Healthcare began receiving the first shipments of the Pfizer-made COVID-19 vaccine. 2 hospitals have it so far. The state's plan calls for it to be distributed to the 5 hospitals best able to handle the vaccine's extreme cold storage requirements.
And we anticipate that several of our other facilities should receive it either tomorrow or by the end of the week.
At the front of the line to get it are those who work directly with COVID-19 patients. It will branch out from there based on availability.
These would include those who work on our COVID units, our ICU care doctors, nurses, technicians, those who work on medical units, those who work on our environmental services and deal with COVID-related waste, those who are in respiratory therapy who help others breathe more safely when they are sick. All of these will be in the first stages, but all healthcare workers are in Part 1A of this vaccine distribution.
Governor Gary Herbert called it a good day and one Utah's been anxiously awaiting, saying in a statement to Fox 13, "This is the beginning of the road back to normal life. I look forward to the day the vaccine is available to everyone, but telling Utahns to continue to follow COVID restrictions until it's widely available." The governor and governor-elect will have to wait their turn to get the vaccine. It's being doled out based on risk, not privilege. The state's plans call for long-term care facilities, teachers, and essential workers to get it in January or February, then the general public anytime from March to July based on availability.
The good news is that this vaccine is finally here.
Critical care workers like Sean Talley will be offered it first.
We are kind of entering a different phase of this. And a lot of the nurses that I talk to and other caregivers are very optimistic about getting it.
Now, University of Utah Health tells me that it expects to receive its shipment of the vaccine tomorrow and will begin inoculating caregivers as soon as possible. Live on the Hill, Ben Winslow, Fox 13 News, Utah.
Ben, we've all learned this year, these caregivers specifically are our most valuable resource. Did they talk about the plan to keep them on the job while they're going through this process?
Yeah, in fact, what they're planning to do, at least initially, is they're going to begin inoculating and vaccinating these frontline healthcare workers on their weekends. So as they get ready to clock out and begin their weekend, they'll get the vaccination. They're being notified now to come in, make an appointment, that kind of thing, to get it. They'll spend their weekend recovering just to make sure there isn't any side effects or there isn't any other adverse reactions. And then it'll go from there. It's administered in 2 doses, 21 days apart.